Not everybody gets all these tests all at the same time, but it just depends on what we think is the most likely diagnosis. There's a question here with regards to testing that one can do to determine whether the joint issues is arthritis and the source of it. So after the evaluation and the physical exam, there's different tests that we can do to determine what's causing your joint cartilage damage. There's imaging studies, and that could be an X-ray study, an MRI study, or an ultrasound study. And this can give us some window to the structural damage that's occurring in your joint. There are some testing that we can do with regards to testing the fluid in your joint to check if there's any inflammatory chemicals in there, or if there's a crystals in there that can cause gout or the other kind of crystals that can cause pain. There are some blood tests that can test for specific genetic conditions or inflammatory markers that are suggestive of systemic inflammation like lupus or rheumatoid arthritis or other seronegative spondyloarthropathies or more of an autoimmune condition. So the testing is designed on depending on what we get from your history and the physical exam. So not everybody gets all these tests all at the same time, but it just depends on what we think is the most likely diagnosis.